Hi, I'm Sally and I'm one of the senior physios here at Perfect Form Physio. I know it sounds corny, but I actually really like making a difference in somebody's life and helping them get back to what it is they want to do again. That's really important to me, and it's really quite fulfilling being able to let somebody get back to running, back to dancing, or back into the gym. I go on loads of courses. Study, study, study. Keeps it nice and fresh. When you've been doing physio for as long as I have, you need to keep on studying to keep on top of everything. In my free time, I like to go dancing. I like doing dance classes. I used to be a professional dancer, so I still miss it constantly all the time. So I do musical theatre classes, tap classes. For the last 5 years as well, I've been doing acro balance or acro yoga. So I meet up with my acro partner and we pretend we're in the circus quite regularly. I also do a lot of gym training, probably about 4 sessions a week, to keep myself healthy and strong and stay abreast of all the new techniques that are coming out. I also spend a lot of time with my cats, and currently I'm fostering kittens, which takes up a lot of my time. I think on a work-related level, I have a few people that I like to follow, one of which is Gary Gray from the Gray Institute, and one is Michelle Dalcourt from IOM. And they really inspire me with bringing all of this modern movement practice to the forefront and allow a ping like us to really benefit from all their training and knowledge. Firstly, to help people feel better, to help them move and enjoy their bodies again. Secondly, my goal is to continue to learn and continue to improve my skills. The more you do physiotherapy, and for the longer that you do it, you realise how little you do know about the human body. The human body is amazing, fascinating, and I still find it incredibly interesting to learn about all the things that are involved with human movement. I think one of my points of difference is that I did have quite a long professional dance career in the genre of commercial and cabaret, so I have a very good understanding of what it's like to manage your life as a full-time dancer, having no money, trying to get treated and having that mindset of auditioning and working. I'm also a qualified personal trainer and clinical Pilates instructor, so I have a huge passion in that, and I'm working as a personal trainer alongside my work here at Perfect Form Physio. I think it's extremely important to be having 1-hour consults. The body, and maybe people don't understand to the full extent, is extremely complex, and nothing is just one joint. It is an interrelated system. So maybe you're coming in with hip pain, but it might be originating from your foot, your first toe. Maybe you're coming in with joint pain and it might be originating from a first toe dysfunction. And so to have a full appreciation of how the body is moving, especially in your first session, you need this time to go into a really detailed full assessment to make sure that we can nail what the problem is straight off the bat. I think one of the main differences is the time that we can dedicate to each patient. I've worked in a lot of different practices over the years, 15, 16 years to be precise, and having that time to go into an in-depth, what we call subjective and objective history, and therefore nail your diagnosis in the first session, is absolutely invaluable. And it also means for you as a client, you don't need to be coming back here for 3 sessions a week. 1 session will suffice. The other thing is that we all have a very strong love and interest in empowering the client and educating them in their body so that they don't become reliant on us all the time to get better. Okay, I started off my dance career or dance training with something called Swinging to Shape back in the UK. And then I started seriously dance training when I was about 6. Like most of you, I did ballet up until advanced. I did tap, took my advanced exams, and modern, took my advanced. Trained in jazz, hip hop, popping and locking, and this was all back in London. Tap, American tap, and rhythm tap. More recently, I've trained in Cuban Latin, so I perform here in Sydney with various different troupes. I do acrobatic yoga, which is partner yoga. I've also done some static trapeze in the past. I've been religiously doing yoga on and off since I was 17, which is quite a while ago. and also do a lot of gym and strength training. So being a personal trainer as well, I've been working in the gym setting since I was about 17, 18, and used to do a lot of gym training to support my dance career as well and keep me fit and strong for a nice long career with dancing. Although this is a clinic that specialises in dancers or people that like to dance, or even if you just want to go to one dance class, I also have a huge passion for people that have no interest in dancing and just want to come because they want to move better, or maybe they want a better posture, or maybe they're doing yoga or Pilates and want to get more out of their training. So please come and see me for anything that you would like doing. Physio looks at the whole body. So we look at every single joint. I'm also trained in visceral manipulation and craniosacral therapy.